So welcome tonight, everybody, and thank you for joining us. I know it's halfway through the week, and if you've got kids, they're just back at school, so it's probably been a longer week than usual. So thank you for giving us your time. So my name is Debbie Dillon. I'm an advanced pelvic health practitioner. I work for Somerset Foundation Trust. I have been here for over 20 years. Into my 21st year with Somerset Foundation Trust. We're a team of 11 pelvic health physiotherapists, and we work across the whole of Somerset. We have clinics in the district general hospitals and also in some of the community hospitals, trying to even it out so people don't have to travel too far. So tonight we are talking about pelvic floor and continence. One of my favorite hashtags is #common, but not normal. I don't do a lot of social media, but that is definitely a great hashtag for pelvic health because it is so common. 1 in 3 women suffer from a pelvic floor issue in their life. And what's great is I don't have to ask anyone to put up their hands or anything. Nobody can see anything, but I bet you're all going, wonder why we've so many registered in here tonight. Women are 5 times more likely to develop incontinence than men. So obviously our anatomy is slightly different, so that makes the difference. But, you know, and also we have babies and everything, but that just shows you how much it affects women. 50% of women do not know how to perform pelvic floor muscles correctly, and that is frightening. So, you know, if you take anything away from today, I will go through pelvic floor exercises. But give it a go, give it a try for 12 weeks. And if you find nothing's changing, then make sure and see a pelvic health physio if you have symptoms. 40% of women are too embarrassed to consult their doctor, which is so sad. So very often in our clinics, people haven't come for years. What happens? The problem gets worse. 50% of women have pelvic organ prolapse post-birth. The stats are between 51 and 54%. That's a lot of women. You know, if you just looked around the room, it's all women here. And if you look, you know, if you can, you know, see if there's so many people here, that basically that's over half of us. So women wait an average of 6.5 years before seeking help, and that's when if they do go to the doctor. So, you know, these are very interesting figures and facts, and they're a little bit older, so it'll be interesting to see the newer, updated version of them. So how many of you feel like that today? You know, or did feel like that during pregnancy, that you are going for a scan, you're thinking, oh my God, I'm just about to burst, getting in the door at home, getting into a clinic, getting to work, whatever it is. You know, can't talk to your kids, I have to quickly run into the loo. You know, and I think this is quite a common one, but once again, it's not normal. So with the pelvic floor is in charge, and I'm just going to flick forward to there. So the pelvic floor, you can see our muscles underneath the pelvis. So I have, I'm not too sure if you can see me, but I have a made up pelvic floor with the muscles. So they're literally underneath, and there's loads of different muscles. And what's happening is they're acting to hold everything in. So they're very much a postural muscle. They equally are used for continence, so bladder and bowel, and sexual function. And they're part of our core. So that's what I'm talking about when I'm talking about the pelvic floor. So the first picture, if you're looking at the screen, it's on your left-hand side, is underneath, and then the one and looking down into the bowl of the pelvis, and the one on the right side is stripping away the buttocks, and that's the pelvic floor at the back. So the pelvic floor starts at the coccyx, some of the muscles start at the coccyx, comes up around in front of the pubic bone and splays out to your 2 sitting bones. And you have some other muscles involved as well. So I'm going to flick back again. So your bladder symptoms. Many people might have symptoms of urgency, frequency of urine. And so not everybody necessarily has to have, if they've got frequency, doesn't necessarily mean that they've urgency. We've got incontinence, leaking with the key in the door, so that latch key continence that we talk about. So you put the key in the door and you're like, oh my God, I need to get to the bathroom, I can't think of anything else. Then you have other people who have no issues, but they only leak with a cough or sneeze. And then you have people who have nothing, but they're out running and they leak with the run, or they leak if they're trampolining, or they, you know, get on the trampoline in the garden. And actually you can have teenage girls getting continence from in trampolining clubs. So that's something if you have teenagers as well to think about. It also can be voiding difficulty, so unable to empty your bladder properly and just feeling you're not emptying your bladder properly. And we also have symptoms of prolapse, which I will go into in a little bit more detail. We also can have bowel symptoms. So as I said, it maintains bowel continence as well. You can have straining of the bowels, can be some issues to do with the pelvic floor. We can have constipation, which affects the pelvic floor. As I said, fecal incontinence, prolapse, and also that just whole bloated feeling can also be intertwined with, kind of a whole mixture of symptoms. So sometimes, for example, people who have endometriosis are very likely to have irritable bowel syndrome as well as other issues to do with their endo. So there can be just loads of different symptoms that can relate. Other symptoms, vaginal dryness, which is very common in menopausal women. Some people can start to get it perimenopause. It can be their first symptom, but equally, it can also be somebody who's just had a baby and they've had their baby, they're breastfeeding, and they're 6 months down the road, and they can find they get a bit vaginally dry because you're having like a little mini menopause after having a baby, with your hormones, as you remember, have all changed around for that little bit, especially if you're breastfeeding. Also, you can have people later on in life, after 60, after their 60s, 70s, 80s, that can be started on vaginal estrogen, or all of a sudden feel have vaginal dryness. So don't just kind of think it's to do with sex. It's not necessarily. You can just have that vaginal dryness. As a result of vaginal dryness, you can have painful sex, and sometimes that's when people realize they might be dry. You can also have painful sex without having vaginal dryness, and there's many different reasons for having painful sex. So we can have vulvodynia, vaginismus. We can have, the muscles are just not letting go and holding too tight, and then they can get into bad habits. Lack of sensation. So some people say that after, if they've had a big baby or a certain types of delivery, they can have lack of sensation, or some of our cancer patients, and also some other patients as well might find that they don't have as much sensation. Pelvic pain. So I'm talking about the pelvic pain that is related to your pelvic floor, because as I said, where the pelvic floor is, it's right underneath. So all of those muscles and these different colors, if you can see this, are showing those different muscles. And last but not least, we've loss of libido and different sexual dysfunction. So I said I'd come back to the prolapse. So a prolapse is when one or more of the vaginal walls or the top of the vagina move downwards towards the vagina. So some people can say, I have an awful bulging, I kind of feel a bulge, and they get a fright because they feel something, or I have a heavy feeling in the vagina. Some people say they can have backache. Some people just find they feel a bit bloated and everything just feels like, some people feel like everything's just going to fall out. So different people come with different things. So different types of prolapse. You have, this picture isn't fantastic. It was quite hard to find a picture to kind of cover them all. So the front, you have the front wall is known as an anterior vaginal prolapse, or a cystocele, which you still hear as well. You can have a uterine prolapse, which is the lowest picture on the right-hand side, the uterine prolapse, where the uterus is coming down. You can have a rectocele, which is the back wall. So that's the second picture on the top right. And that rectocele is where the bowel kind of protrudes down. And what it does, the scaffolding almost of the vaginal wall isn't able to hold everything, and it kind of bulges in towards the vaginal area. Usually can feel quite squishy, but obviously if you weren't emptying your bowel right, you might feel it a bit harder because you might be able to feel fecal matter. So pelvic floor muscle exercises are one of the first go-tos. So the NICE guideline recommends having 3 months of supervised pelvic floor exercises to help with symptoms. There is many people who come into our clinics with different symptoms, and actually when we examine them, we find that they have a prolapse and they've had no symptoms and it doesn't cause them any issues. So they're, if that's over 50% of us who've had a baby have a prolapse, there is many people walking around with one and it's not causing any issues at all. Okay, so it doesn't always have to be treated, but pelvic floor exercise is number one. Lifestyle advice. So really, really important with a prolapse, or if you know somebody said, oh, you know, you have a little bit of laxity, or you might have the beginning of one, super important, do your pelvic floor, but also make sure your bowels are regular. So we should have a Goldilocks stool, not too hard and not too soft. And that's really, really important because how you poo will make a big difference to that strain going down through that pelvic floor. Ensuring a healthy weight, because if you're carrying extra weight, where is it going to go down? Through that pelvic floor again. And by keeping fit and active. Obviously, just being careful that things don't aggravate what you're doing. And most exercises are fine to do when you with your pelvic floor. It's the heavy weights are the ones to be careful of. But there's a research done which shows actually putting down your yoga mat is much more intense than lifting certain weights. There's a huge force goes through your pelvic floor, just throwing your mat down to get down on the floor to do some exercises. So we shouldn't be scared of everything. And what we know for menopause and for women in general is we should, you know, make sure we use and keep our muscles well by using weights. And that doesn't necessarily have to mean lifting and doing huge weights in the gym. It's our own weight can be used for that. And if necessary, you can use a vaginal pessary. Which can be obtained with some GPs. If not, you would need to be referred in to see the pessary clinic or via the consultant, depending which pathway one is able to do. And I have put a link, and I know that links will be sorted out for afterwards, to a very good vaginal prolapse leaflet, which is by the POGP, which is Pelvic Obstetric Gynecology Physiotherapists, and it is a subgroup of the Chartered Society of Physios who manage a lot of very, very good literature if anybody ever wants to look something up. So back to my pelvic floor again. I do love this picture. I keep pulling it out every time I do any teaching of the pelvic floor, because I just think it shows so much of how low down in it is, but how much, if you think of all the bowel, all your organs, your viscera are all in there. And then depending how much weight we carry and those forces. So if you're lifting something heavy, those forces go right through that pelvic floor, and it's those muscles that are holding it all up. Obviously, with the core muscles, you have the front, which are the abdominals. You have the back muscles, okay? You have the top, which is the diaphragm, and then you have the pelvic floor underneath. So we're like a cylinder. And that's so important that we make sure we maintain those muscles in good working order. I'm a physio. We love muscles to have a full range of movement, and that is no different with the pelvic floor. And then from the other picture, you can see it looking backwards at the pelvic floor into the back, and you can just see how much of those muscles. So if you're looking at the diagram, you can see here how much of the muscle is around the back passage, and it gets a little bit easier as it goes up to the front, you know, a little bit less bulky. And that's why we have more issues, because if you think anatomically, we were designed to be on all fours. But as we've evolved, we've ended up standing up, and we are now, what are we all doing? We're all probably sitting down at this. Most of us have probably sat for most of the day today. I know I've been on a lot of meetings all day today. So we're not made to be like that. So that alters how our pelvic floor works as well. And we've adapted to work with it. So, you know, we're not the best designed for the way we are now. Okay, so first, plenty of things to do with what a pelvic health physio and what to do with your pelvic floor. Anybody who walks into clinic, we will ask you 101 questions. But the first thing I teach any junior staff coming, if you don't sort out the bowels, you'll never sort the bladder out. So first of all, anyone who's here on the call and have any issues to do with continence or bladder issues, this is so important for you as well as anybody coming with bowel issues as well. Okay, and actually generally, it's a really good habit to get into to be have good bowel motions. We love a routine bowel motion. Women are the worst. What do men do? They have their cuppa, maybe in the car now on the way to work these days. They get to work if they're not working at home. They go straight to the loo, they perform, and off they go for their day. Women hate going in outside loos, okay? But what we don't want to do is we don't want to keep putting it off just because it doesn't suit and I couldn't use that loo and I couldn't use this loo. So try to get yourself into a routine. One of the best ways to get your bowel working is actually your first hot drink in the morning can get peristalsis to work. Okay. And so if you need to get out and you're on a timeline, you have to bring the kids to school and you have to get to work and you have time, go downstairs, make yourself a hot cuppa. Up you go, start getting ready while you're drinking your cuppa. And then about 20 minutes to half an hour later, you should be able to go to the loo. What we want, and that's why I've put this lovely Bristol stool chart, so apologies for anybody who's just had their dinner, we want you to be between type 3 and type 5. We don't want type 1 and 2 as constipated. Type 4 is the perfect one. So literally between 3 and 5 is like a Goldilocks stool, not too hard and not too soft. If you're struggling with fecal incontinence, you definitely want to be a type, you might even want to be a type 3 because it could be harder to hold a type 4, but definitely a type 5. And for those people who find, oh my gosh, I'm fine, I'm really good with my bowel, but my gosh, if I have a funny tummy or if I have loose motions, that's it. And that's because the harder it is without being constipated, the easier it is to hold. And so it's really, really important to make sure you're having your Goldilocks stool. So none of you will ever think of Goldilocks in the same way again. The other picture I've put up is sitting on the loo. So you've all probably heard of many different things to do with squatting on the toilet, but ideally you want to be sitting where minimum your knees are at 90 degrees. But most toilets are actually, well, they're too high for me, who's 5'4" and shrinking. But, you know, you want to have your knees slightly higher than your hips if you can. To be honest, that stool looks quite high on this one, but the knees aren't too bad, okay, on my model there. But that's roughly just above 90 degrees. So you're sitting comfortable, but in a squat. What that does, and the pictures underneath, it opens up. So the reason we keep our continence, if we've an anorectal angle that's pulled by the puborectalis, which is one of the muscles, the pelvic floor muscles at the back, and holding the contents. And so when we sit down on the toilet and we're sitting with our feet flat, and that's really important. So in case you think, oh, my toilet's okay, I can put my toes, I can be on my toes. That's going to tighten all of those muscles. And actually, what you're doing is you want to relax everything. And if you think in France, a lot of the toilets are kind of the long drop ones where you're standing and crouching down in a real squat. And actually, that's the perfect way, the way we should be pooing. So this is what we're trying to mimic. If you have the right position, then, and you're relaxing and you have no other issues with your pelvic floor and it relaxes nicely, then it should be able to just relax and the tension of the puborectalis eases off and hence you can go to the toilet. You don't want to be sitting on the toilet for longer than 10 minutes max. Okay, you don't want to get into that habit of just sitting there. And my biggest pet hate is telephones. Do not bring your phones into the loo. You're better to have little books or joke books or, you know, have the newspaper or a magazine or whatever inside in the loo that you can flick through if you really want to. But please, you're better off without your phone because you lose the concentration and you're not kind of concentrating on the kind of task in hand. The other thing is when you're sitting there, what did I just say earlier about the prolapse? You don't want to be pushing down and then you're going, yeah, but I'm sitting there, it's not coming. So ideally, what you want to do is you want to blow as if you're blowing out candles. So instead of being a okay, think of blowing out 40 candles. So you're, okay, a proper blow rather than just, okay, and that's really good because what that does is it bulges and braces in the right places. A continence nurse many years ago at a lecture taught me that technique, and that's one I've passed on to the patients ever since. The other thing is you can use bubbles. Kids, we sometimes use bubbles, but I have been advised you have to warn to be careful that nobody slips on the surface because of the bubbles on the floor. So just putting that out there. So that's a really good one. And kids should be, and their kids' stools actually are really good as to get you into a squat. So if any of you have the kids' stools, don't get rid of them. The other thing is you can do a moo. So some people find moo. I always think, would I go into a loo and go moo? But it can help. And the other one is grr. Different people prefer different things. So I always say them all. I do find the moo and the grr a bit funny, but you know, everyone to their own. There is very good, our dietetics team have amazing patient webinars on a huge range of things. And all of these webinars can be got on patientwebinars.co.uk or by going through a more complicated way, but I've put the link there. And those webinars have a really good one on constipation advice. For anyone who has irritable bowel syndrome, they're doing a really good one on that. And anybody who might want to look at any weight stuff, they're doing an excellent one on that. And what's really good, and I know their bowel one has been updated because we're involved in it, they're really good at getting other people from around the country involved in all their webinars. So they're not all just made in Somerset. And I know the dietitians are across the whole of the UK are actually using their webinars. So bowels, you want to be, I forgot to say, constipation is if you're not going to if you're going to the toilet less than 3 times a week. Yeah, so, you know, some people go 4 times a day. That can be your normal. Some people can go once every 3 days. That can be your normal. So it's just making sure you've a Goldilocks poo. And what you don't want is to be either end. So you don't want to be a type 1 or 2 all the time. And you also don't want to be a 6 or 7. Sometimes you could be a type 1 and then have a 7 because you're impacted and the rest of the poo is trying to get out around it. So, you know, just be aware. And obviously, if you had ever any change in your bowel, you know, always go and check with your GP, or if there was any blood that you aren't sure why, always make sure and check with your GP and keep up with your any tests that you're sent that you should be having. Okay. Intimacy. So I thought instead of this one coming at the very end when everyone's tired, I would bring it first before some other stuff. So a lot of the patients we see in clinic have also got sexual dysfunction, or actually very often people come in and get referred, all ages, all problems with their pelvic floor. But then because we ask you so many questions, we ask you about your bladder, we ask you about your bowel, we ask you if you've had babies, we ask you about periods or menopause, and we also ask you about if you're sexually active. So intimacy is very important to, you know, if it's painful, it never should be painful. So if you had a baby and it's your first time having penetrative sex afterwards, of course, it might be a little bit painful. And of course, you're going to be nervous, but it should get easier. Okay. It shouldn't stay painful. Yes, somebody's first time having sex. And if they haven't had sex for a long time, it can be painful, but it shouldn't stay being painful. So if you're finding by all the things I've said today in any of the lectures and you're finding you've any problems, then go and have a chat to your GP. So what's really important first is vulval care. So some people find that they could have a bit of a skin condition. So they could have a bit of dermatology on the vulva, a bit of eczema, I should say, on their vulva. There's other skin conditions that one can have as well that can make it uncomfortable. And so what's really, really, really important, and I can't stress this enough across the whole age range, is we don't need to wash with fancy washes at all. We shouldn't use any of them. And all these aisles that they say vaginal washes and safe for vaginas should be put in one big bonfire because most of them aren't the best. So we should really only need water. Our vaginas are like a self-cleaning oven. So that's why we get discharge to help. And that's why you should always, if you have a different discharge and it's different for you, go and get it checked. Any color or, you know, kind of, you just feel it's not right, better to make sure everything's okay, never doubt. And another really good chance of getting everything checked is making sure you attend your cervical smears because they have a look at everything as well. So vulval care is really important. If you feel you're dry down there or somebody has examined you and went, you're a bit dry, or you feel it's a bit irritable, try an emollient. So there is plenty of emollients in the supermarkets, in the chemists. So you have like your Hydromols, your Sertrabans, your Diprobase. any of those, I tend to veer away with people from E45, but using those, and you can use, some of them have washes, some of them have creams. But the one thing I would say, if you want to use a wash and you're using that, and then you feel you have to have a cream as well, or you have a cream, try and keep to the same company or the same type of ingredients, because otherwise you're adding in loads of different ingredients, which then might cause more problems. So it's really important to make sure you're looking after the vulva. I always say to people, treat your vulva like your face. So we should really be looking after it. Then it comes where you find, oh, it's feeling a bit dry and it's just not comfortable. It could be that you've noticed it with sex. It could be that you've started to get some urine infections and it's just not comfortable. Very often that's because it started to get dry. So as menopause hits and we lose estrogen, so it can happen perimenopausal. And as I said earlier, and it says here, it can happen postnatally with breastfeeding. And so what happens is you need to make sure you're not going to have any extra moisturizer there, because for everybody's different how they're affected by menopause. So some people, for whatever reason, they really need their estrogen there and they're just not getting it. So if you don't want to go straight onto vaginal estrogen, you feel, no, I want to try other stuff first, there is very good vaginal moisturizers. So the main ones tend to be the Yes, 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 and it's called VM, vaginal moisturizer. And there is also the Halo Femme. And the two of those seem to work really, really well. And you can use them. There is no hormones in them. You can use them as much as you like. So what we advise is people to put the inside at night, because then it can reabsorb. The Yes one, some people, the pipettes are easier than buying a tube of it. So definitely they're easier that way. The Halo Femme comes with an applicator, so it just depends which you prefer. The Yes products also do water-based lubricant, which is very important if you're having penile penetration, because you obviously need the extra moisturizer. They also do a double glide, which they use an oil-based, which you can't use if you need to use a condom. And don't forget, if you are just because you're older and if you have multiple partners, make sure you use a condom, because obviously between sexually transmitted infection, it's important. So you can use lubricants such as the Yes WB, which is water-based. And if you're not using a condom, you can use the Yes OB, which is oil-based. And actually, they do a lovely thing on oil-based and water-based together if you have a look at their website. Other than that, there's another really nice one called Subtle, which you can get from Joe Devine, which is another very good one. And they do a deluxe and they're just water-based. You also have Silk, SYLK, but that does tend to dry out much quicker, to be honest. And there used to be Replens are still around. I don't find from my patients that that's as good a vaginal moisturizer as the others, to be honest, but there is that one around as well. Some of these are quite hard to get in your pharmacy, that actually they can be got online. So just to let you know. So really important for lubrication. It doesn't matter what age you are, lubrication keeps everything really healthy. And the other reason why I say these lubrications and moisturizers is they maintain the correct pH. So some of the brands that you'd see over the counter all the time don't always have the right pH and aren't the best things for your vagina and vulval area. And as I said, if you're postnatal and breastfeeding, make sure to have a chat as well, to, kind of using any of the moisturizers, lubricants, and then onto your vaginal estrogen. So anyone who starts vaginal estrogen, it is on prescription. You'd have to be assessed by your GP, and then you start a course, usually over 2 weeks loading dose every day, and then you'd only use it about twice a week. If you stop using it, if you're menopausal or perimenopausal, you're going to get back to your symptoms again. So particularly if vaginal dryness is an issue, or if you're getting a lot of wee infections, a lot of people are put on vaginal moisturizers. So it really is something you continue on for life if you want to maintain it healthy, if that's what you need. Obviously, chatting to your GP about that. With regards breastfeeding, once your hormones return to normal and the GP was happy to give you vaginal estrogen, then everything should return to normal again. But I always advise new mums and postnatal mums, you're better off to use lubricant anyway, because it will make it more comfortable. So, pelvic floor exercises. Biggest thing I'm going to say today, it's not all about strength. Everybody presumes they've got leakage. Oh, my pelvic floor is weak. You know, if I told everybody now, I'm going to tell you all who can't see you, which is a bummer, because it'd be a great picture. I'm going to tell everybody, squeeze your pelvic floor and let go. Okay. Now, have a think now how you're squeezing your pelvic floor. So let's squeeze your pelvic floor again, and let's count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and let go. Okay, how many of you are going, I lost mine ages ago? How many of you are going, I could have kept mine going forever? And how many are going, 9, 10, and they're right up there trying to count it? Really, really important that you breathe while holding your pelvic floor. Okay, so as I spoke earlier and explained the whole cylinder to do with your core, you can see in the first picture, you can see the diaphragm on top. You have the transverses and the abdominals. The transverses should be slightly lower on the diagram. And then you have the pelvic floor muscles underneath, and you have the back muscles on the back. Okay. And so what's important is when you're doing your pelvic floor, you actually breathe in initially. So it's you breathe in to prepare, but not because when I get everyone to do it, they go, but we don't want that. You're running to grab your child, or you're running to catch the bus or whatever. You don't want to be taking in a huge breath. So you basically are just taking in a normal breath. You should feel your rib cage, you should feel the breath going down into your rib cage and into your belly. Okay, so everybody now put your hand on your tummy, and if you can, put your other hand on your rib cage. Okay, now try and breathe into that belly. You don't want to feel you're pushing it into your belly. You want to feel as if you're breathing into your belly. And let go. Okay, and again, breathing in and let go. Now what I want you to do is breathe in again to that belly, and now squeeze that pelvic floor and let it go. So what you're doing, you're breathing in to prepare. On the out breath, you're pulling in your pelvic floor muscles. So pelvic floor muscles, you have loads of different muscles. Okay, my model isn't very good because they're made of plastic and laminated. There should be another hole in the front. So that is the pubic bone. That's the coccyx. Okay. And so what you need to do is you need to zip up at the back passage as if trying to stop passing wind. And you're zipping it up past the vagina, the urethra, and up to the pubic bone. Okay. So what you're going to try is just zip that up now for me. So just zip up that pelvic floor and let go. Now, let's go back to the breathing. So you're breathing in to prepare. On the out breath, you're pulling in that pelvic floor muscles. And now you're going to count out loud to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and let go. Okay, so that's what's really important, that you're zipping it up. So from the back passage all the way up to the pubic bone, like a tight pair of jeans. If you find you're not getting it right up to that pubic bone, sorry, I can't speak, pubic bone, make sure and give it a double pull, because that's really important that you're getting that whole zip. Okay, and then you're holding it and counting out loud to 10. So for those who went off at 2, that's fine. You hold for 2 seconds and you see how many times you could repeat. We're aiming for 10 seconds, 10 times. So if you're holding for 2 seconds, just say, figure out of the air, you can do that 3 times. That's what you're going to do 3 times a day. Okay? So these are your endurance exercises. So you're zipping up at the back passage, you're pulling it all the way up with that zip, up to that pubic bone, holding for a maximum of 10, and then you're making sure to let go. And that's really, really important. For those people who kind of aren't too sure what they're holding and they kind of feel they've lost it by it gets to 10, make sure you're really doing your breathing. So some people, when they pull in their pelvic floor, instead of starting at a kind of more relaxed state, it's never off totally because, as I said, it's a postural muscle. You need to make sure that you're starting here and not up there. So, that could be the reason for your continence, actually, your incontinence, I should say, that you're holding that pelvic floor too tight. You're not letting it relax. So it's so important, tighten that pelvic floor, then let it go. Okay, so as I say, you breathe in to prepare. On the out breath, you pull into that pelvic floor, you count out loud, and you're continuing to breathe. That's why I get you counting out loud, so that you're going 1, 2. You don't want to be going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we all could do that holding our breath. So really make sure and count, 1, 2, because you have to breathe. And then you're going to see how long you can do. If you find you're holding your pelvic floor and you can't leave it go, then you're just going to work on your breathing and you're not going to do any other contraction. As I said earlier, the pelvic obstetric gynecology physios have a lovely pelvic floor exercise leaflet, and there's the link on that. So with your pelvic, if we go back to this one, so with your pelvic floor exercises, there's only 2 ways to do them. So we've spoken about it, the endurance and the importance of making sure you breathe. The other thing I forgot to say is when you let go and you finish doing them, make sure you relax and let your pelvic floor go. The other way to do them is the quick. So you can see my hand. So when you're doing the quick, you're squeezing that pelvic floor and you let go. Don't worry about the breathing because you'll just see stars if you're trying to breathe in to prepare, breathe out. It just won't work. But as you're doing better with the other ones, you'll get the carryover. So you squeeze that pelvic floor, you let go. It doesn't matter if it takes that long to squeeze the pelvic floor and it takes that long to let go. What's really important is that's what you do. Because we want full, at the very start of the talk, I spoke about full range of movement. The pelvic floor needs its full range of movement to get as many of those muscles as we can to work. Anybody who's had children might have some tears. Any new mums and mums in the first year, if not even 2, and have any issues with either painful sex or find, kind of they've a problem in the pelvic floor and they had a tear, make sure and give it some perineal massage, and massage into that scar area will help as well, using a little bit of lubricant, and that will help stretch out as well. Pelvic floor exercises should never be painful. So you're aiming to do them 3 times a day. You're doing your endurance, which is max hold 10 seconds, relax and repeat that maximum of 10 times. You're doing your quick ones, 10 in and outs max. Where people go wrong is they're doing their pelvic floor and they're being brilliant, but they're doing it every time they go into bed. They're doing it when they're sitting watching TV. They're doing a few in the car. They do it when they think of it, but they're not completing their endurance, and they're not tiring or fatiguing the muscles. It's like any other muscle. If you went to the gym and just went, oh yeah, I'll do a few bicep curls, I'm done. You haven't fatigued the muscle, not going to make any difference. You're inside in the gym, you're doing your bicep curls and you're having a good chat with your friend about what the gossip is on the weekend. If you're not concentrating and really working hard, you're not going to improve, that you're not going to get a change in your muscles. So you have to put in the work. What's brilliant with pelvic floor, it doesn't take long. So everybody needs to start at a baseline wherever that may be. If that's you in lying because you can't do it in sitting, that's where you start your exercises. Do them in lying 3 times a day. If then you're getting better, but you're better in the morning, do them in sitting in the morning and afternoon, and then in lying when you go to bed. As you move on, you're moving it into, sitting and standing. So you might find in the morning brushing your teeth, brilliant time. Yeah. And then you're doing it in sitting the rest of the day. And so on. So the biggest thing is that's where I find people come and they say, oh, made no difference doing my exercises, and they come in with their arms folded. I don't want to be here, but I have to fill a tick box. And to be honest, most of the time we do get round everybody and educate them. And actually, it's like any other muscle. So progression is huge. So you start in lying. And if you're too good for that, you start in sitting. Too good for that, you go into standing. If you're too good for standing, you go to stride standing. So your legs were wide apart. That's much harder. Go down into 4-point kneeling, is another really good place. And it's also great for the abs as well. Bring it into starting to do some, you can use a TheraBand, or you can squat down and take a side step. You can do it with just some squats up and down, holding with your squats. You can do it with some lunges. If you're somebody who walks the dog every day, you can start practicing to getting it into steps in the kitchen when you get that far, and then practicing doing a good few lengths of the kitchen that then you can bring it into every time you walk the dog. So everybody, you really need to get your pelvic floor up and running for three months. And then you can, if you've no symptoms, you can reduce down to once a day and whatever you want to do forever. And you keep on making it more difficult. And that's really the crux of it. So when it gets easy, you move it on. You will never be holding for more than 10 seconds, 10 times, or 10 quick ones. Or I have some people might walk the dog and they do a minute, and then they relax, and then they do another minute. Whatever suits you, you can bring it into your gym regime, which is very important. So doing your pelvic floor 3 times a day to start off with until you're symptom free, and then once a day forever. Bring it into whatever exercise regime you have. You are also going to do your endurance. So starting off with 10 seconds, aiming for 10 seconds, 10 times, and 10 quick ones. When you're doing them, you're going to make sure you're breathing for the endurance, and you always make sure you let go after you've done a contraction. So squeeze, you're holding, you let go. You're doing a quick one, you squeeze, you let go. It's so important that you fatigue the muscle to change them, and keep moving it on. That's why it ends up not working as well, and you're not getting the benefit. The other thing is, other patients come into clinic and they find, oh, every time I cough or sneeze, I just, it doesn't work. Or every time I'm out running and I just always, every time I get to that bit, it happens. I go for a wee, I don't drink, I don't do this. What's really important is keep drinking, because that's really important, but I will come back to that. With regards your pelvic floor, what's important is you also teach it how to be used. So we call that the knack, functional bracing. So when you go to cough or sneeze or blowing your nose, pull in that pelvic floor in your lower tummy and cough, and then relax. And you keep practicing that, blowing your nose. So pull in your pelvic floor, blow your nose, let go. Okay. And that's really important, because that's teaching your pelvic floor, increase in intra-abdominal pressure, pick up underneath. Okay. Which is really, really important. So then you find you're at the gym and you're doing CrossFit and you have no other issues with your pelvic floor, making sure you're pulling in on the right techniques, that you're taking in that pelvic floor. Don't increase your weight if you feel, oh God, I feel everything's going to fall out. Stay on the same weights. Even though you're doing good, make sure that pelvic floor is coming in as well. Okay. So those things are really important. The runner, you're running, you might find it's every time you're downhill. You might find if you lean forward, that helps you a bit, because you're getting some support with the pubic bone. You might find leaning back. Some people find they lean back and it helps. Or you might find a bigger or smaller stride. Just do something slightly different, and that might help you as well as obviously, as well as doing your pelvic floor. But those little things can help. What you don't want to do is run around and hold your pelvic floor for the whole time, because that's not going to help. It's going to fatigue. So you use it as you need it. And that's what's really important outside of doing your exercises. I also spoke about fluids. So fluids is very important. Of people who have bladder urgency, or who have bladder urgency or a frequency, we should all be drinking 1.5 to 2 liters every day on a normal weather day, not excessive exercises and sweating. Obviously, it needs to up if you're doing more excessive exercise or the weather's very warm. You should be drinking, so if things like caffeine irritate the bladder, don't forget green tea is quite high in caffeine. Also making sure that your fizzy, things like fizzy drinks can irritate. Some people do find that decaf can irritate them. And some people don't find it makes any difference between having caffeine or not. We used to tell everybody get off it, but we don't do that, as we know, we do still say for some, but it's always worth trialing it. Biggest alert, never just stop your caffeine, even if you're only on 2 or 3 cups a day, because you will get withdrawal symptoms. So please never just come off your caffeine. So caffeine, fizzy drinks, alcohol. They're the 3 main ones that irritate the bladder. So you might find, if you are going to drink, some people find that they play around. So some people might find wine doesn't matter to them. Some people find that beer, they can't touch it, or they can have a spirit. So sometimes it is worth playing around to see. The other thing is making sure you're well hydrated. So drinking water in between will really help. The other thing is it goes over a 24-hour period. So if you didn't drink a lot today because you're going, I'm not going to drink because I'm going out and I don't want to wee all the time, that will affect you tomorrow. But actually, it could make you worse. It will make you worse because you need the fluid. The bladder doesn't like concentrated urine and it gets quite irritable. So with the bladder, you've different types of leakage. So the leakage of when you don't make it to the loo on time can sometimes be due to the detrusor muscle in the bladder, which just gets a bit irritable. And sometimes after doing your pelvic floor and your bladder training and your hand on heart, you've tried, it's worth chatting to your GP or going to see a pelvic floor physio or seeing the continence team about things to help you. But then the next stage might be having medication, and sometimes that can help. And sometimes it's also really important for the people who might get up at night a lot. Sometimes it can be due to perimenopause, menopause, because the estrogen, as I spoke about in that area. But sometimes it can be that you come home from work, you've been full on all day, and then you're drinking till anything between 9 and 11 at night or later. And so then, of course, you're going to get and need a drink. You might drink loads because you're feeling you're having lots of hot flushes. You might be a mum. Obviously, mum's breastfeeding is slightly different because you need to take in fluid as well. And you're usually up with the baby, but you might have got into the habit. I always tell everybody the bladder is like a naughty child. You give it an inch, it takes a mile. So really important to not give into it all the time. It's very important to, tell it, no, I don't need to go now, so that you're telling it what to do. And apologies, I forgot my slide for that one. I just got lost in transit. So I spoke earlier about pelvic floor and posture and sitting. As you can see, a lot of the muscles affect in towards the pelvis. And so posture, movement, exercise is really important for the pelvic floor. But what do we find? People don't do it because they're petrified they'll have a leak. So ease down on what you're doing. So instead of lifting big weights, reduce down to what you can do. Make sure you're drinking enough because that will help. Make sure you go for a wee before you start your exercise. And if you have to initially to get you active to help get everything moving, you might have to wear a pad or pants like the period pants. You can get pants as well nowadays that can really help. To get you to start, because if you lose the weight, I can't remember, there's a stat that every 2.2 kilograms of weight you lose, it makes a huge difference to the pelvic floor. So, that is really, really important. So I can't stress enough the importance of posture, getting moving, yoga, Pilates, really, really good. Use your pelvic floor. It's another way of getting your pelvic floor exercises into the routine. It's not going to last the whole class, but if you keep on bringing it in and out to things, you'll exercise your pelvic floor. But what are you going to do when you finish any exercise and stretching and any of that? You're going to relax, which is really important. Remember what I said, leave that pelvic floor go when you're not using it. And most exercises are very good. The biggest thing is just being careful of weightlifting, especially with prolapses. The amount of times people say of all ages, it doesn't matter any age. I wish I was referred a long time ago. You've made such a difference. And if I've been doing this for 24 years now, I think, pelvic floor almost solely. I'd be a multimillionaire, I think, for every time this has been said to me. And it's really sad, actually, because, you know, if I can just change a few people's life tonight and get them doing it and just change or get them to know where to go, that's huge. These are some of the resources. So I haven't mentioned the Squeezy app, can be very helpful. I do think the Squeezy app is particularly helpful earlier if you're kind of more in the sitting, standing, or if you're somebody who likes an app postnatally, or you like an app that gets you to do it initially. But as you move on and get better, that's important that you keep progressing, like I said, because that's where a lot go wrong. Bladder and Bowel UK are very, very good. You can also get a bladder bowel card that says I need the loo, which is important. The Yes products and the pelvic obstetric gynecology physio have lots of leaflets on everything from prolapse to postnatal to continence, male and female pelvic floor, transgender leaflets, and it also has some surgery leaflets as well. What did I say? Hashtag common, but not normal. So yeah, it is a very common, but not normal. And then the other one should be hashtag normal, but not common, because most people don't want to have an oopsie moment in their class. But it's really important that we do work in this pelvic floor. And as I said, remember to let it go. Thank you very much.
Thank you, Debbie. That was absolutely brilliant. And I think just looking at the number of people that we've got here tonight, it just shows how important it is for people to be educated about stuff like this, because we know it's a sensitive subject, and we know a lot of people do avoid seeking out medical help. So thank you, Debbie, and thank you everyone for coming tonight. So as part of the registration process, we did ask for questions. And my goodness, did you give us some questions? So we can't go through all of them, but we will go through a few. So here we go. Debbie, if you have a cystocele and have tried regular pelvic floor exercises for a number of months to little effect, is there anything else that can be done to improve the condition?
Yes, so a cystocele, for anybody who's not sure, is, as I said earlier, it's the front wall of the vagina, so it's an anterior vaginal wall prolapse, and it can affect how people wee. It can give incontinence, or it can just feel uncomfortable. So yes, pelvic floor exercises are really important. If the doctor has told you to do pelvic floor and you've been really trying them, and after tonight's you've tweaked, I would be getting a referral to your pelvic health physio to make sure that you're doing your pelvic floor exercises correctly, and equally to make sure you're progressing on. The other thing, depending how old you are and whether it's menopausal time, I would be looking at vaginal estrogen, if that's something that might help. I would make sure, as I spoke earlier about all the skin condition, that that's all okay. And I would make sure you're not lifting very heavy. So like if you were lifting loads of weights in the gym and this is making things worse. So you could be trying to fix it with pelvic floor, but then putting those weights through it, but not doing it properly. So hence that's where the physio could also help you.
Thank you, Debbie. Okay, so how to overcome increased nocturia after physical injury stroke fall.
Okay, so for any people who don't know, nocturia is getting up for a wee at night. And I think I said earlier, is in menopause, this can be common because of the lack of estrogen and just those tissues getting a bit thinner and not working as well. So it can be. To be honest, it shouldn't really happen after an injury or fall. So it would depend on what the injury or fall was and why you're getting the nocturia now. It could be coincidental. It could also be, if you had an injury or fall, that your muscles aren't in as good a state as they were because you're more static. And obviously, the older we get, the more we lose of our muscle bulk. So that could also be the issue. So I would try your pelvic floor. I would also chat to your GP, and bowels is the other thing, making sure your bowels are regular to help nocturia. But I would chat to your GP if it's not getting better.
Thank you. I'm on Oversting cream. Is there anything else I should take for stress incontinence and urgency?
Yeah, the Ovestin is probably helping, making sure you're having it regular. I find people putting it in on night, they get more in and it doesn't lose it. Doing your pelvic floor to start with, making sure you're doing it properly, making sure you progress it on. And with the urgency, I would make sure you're having the correct fluids, drinking adequate fluids. And I forgot to say, um, drinking adequate fluids is 1.5 to 2 litres, but I would never send somebody out of my clinic doing that today. I would say increase gradually as you can. So, a glass every 3 or 4 days increasing. And if that isn't getting any better, I then would get a referral to physio.
Well, thank you. I've heard about people taking Jude tablets, but they are very expensive. Is there an alternative?
Yes, they're very expensive. There isn't a lot of evidence, to be honest, on these. I can't say I haven't taken Jude. I have looked at the ingredients, which are pumpkin seeds and a few other things, but none of that really would make me feel. So if you think going to the gym, if we all could take a supplement to get stronger, that would be brilliant, wouldn't it? But we can't. We have to make sure everything is in working order. So I don't think it's worth buying them, but that would be my opinion, and I think a lot of other pelvic health physios' opinion.
Thank you. What are the treatment options for grade 3 multi-pelvic organ prolapse?
Well, I would be probably, I'd be making sure you're doing your pelvic floor and making sure you're doing it properly, making sure the bowels are working because you don't want to be pushing down. You may need a pessary, but you're probably going to be seeing a gynae to give you support and whether you need surgery. If you need surgery, yes, there can be a bit of a length of wait. I think they have got better on some of their weights in surgery. But I do think, you can never be doing your pelvic floor, even if you need surgery, because afterwards you're going to make sure you need it working. And that's really, really important. Be careful when you're lifting that you are supporting everything. If you're standing, so just say you iron and you're doing it in standing, could you do some of it in sitting? So, don't just stand with the same weight through the place. If you're in a queue, go from leg to leg rather than just standing there in one position. I hope that helps.
Thank you. How can physio help me live comfortably and do all the activities that I want to do?
Okay, so this could be answered at the teenager doing trampoline. So, because I don't know what age of a person asked this. So it could be the teenager doing trampoline that, learns to use their pelvic floor correctly so they continue doing their trampoline. It could come to somebody who wants to get out doing running their 5K. So the importance of doing your pelvic floor, progressing it on. And as I said, that's what's so important. We always hear, I do it when I'm in bed. I do it sitting down. I do, not many people say I do it just standing there. I do it in the car is a common one. I do it washing up, so they'd be standing, but you don't continuously fatigue it. So I think going back, that's what's really, really important. So that then you're basically, so when somebody comes into clinic, one of any of the team or anyone who's seen the person will ask, what do you do? What's the problem? What do you want to do? Because if that's somebody who wants to just walk to the shop, that's 5 minutes down the road without having a leakage, that's what we're trying to get. If it's the person who wants to do their triathlon, that's what we're trying to get. So it just depends which way you are. But the more you're working those muscles now, the better they will be on the long run. But obviously making sure bowels work and making sure you've a good, healthy weight. And sorry, I haven't said along all of this, some of it can also be genetic to do with prolapses as well and different things. So I hadn't put that in.
Thank you. How do I calm down an overstimulated bladder?
So it depends. It can be on bladder training with some bladders, so a mixture of bladder training. So as I said earlier, making sure to have adequate amount of fluids, so 1.5 to 2 litres, not starting that tomorrow, adding in gradually. If you're also getting up at night, reduce your fluids back to kind of 6. Some people I've even back to, I had somebody yesterday who doesn't drink after 5 bar a glass of water, a small glass of water, but, move it right back. But at the same stage, making sure that fluid that you've moved back, you're not losing it. You're still getting adequate amount of fluids. Looking at caffeine, is that an issue? Always making sure it's gradual withdrawal, because you can get a horrible withdrawal. Look at alcohol and other drinks, no fizzy drinks. And don't forget, caffeine is in Coca-Cola, is in hot chocolate. So people, oh, they'll have a hot chocolate before they go to bed or something. It's, you know, caffeine is in that. So that would be starting off. They would be the things you're doing. The other thing is, as I said, it's like a naughty child. So you have to start training. If you give a child and you say, so one of my kids comes into me and says, Mum, can I have a packet of sweets? And I'm ignoring them. And I'm like, go away. I'm doing my webinar. Don't go away from me. And then this is bringing back reminders of COVID homeschooling. And, they come in again. Oh, can I have that? And I'd be flicking, go away, you can't have it. And then eventually I'll be, oh, there you go, just get it. So I don't have to worry. That's exactly what your bladder does. Your bladder will go, you need a wee, you need a wee, you need a wee. And you'll go, no, I'm fine. You need a wee, you need a wee. And then you go, oh God, I better go because something will happen. So the other thing is, be comfortable where you're doing it. So at home is a good place to start. So if you get that feeling you need to go for a wee, just put it off for a second. You're always better to stay static instead of getting up. So if you got up and you kind of feel you need a wee, just fix your jumper, fix something for a second and just stand there and then move. If you feel, okay, I still need a wee, but you feel like you can hold it. And if you have 2 toilets, go to the toilet upstairs if you can. If you have an upstairs, downstairs, go to the toilet upstairs, because that just makes it longer. Or put something into the kitchen and then go to the toilet. So things like not going straight to the front door, getting the stuff out of the boot and going, I must bring that stuff to the dinner, to the kitchen, and then I'm going to go to the loo. So just breaking the habits. That's the other thing. And both of those together. And then last but not least, obviously your pelvic floor, because that will help as well. But last but not least, medication. You might need certain medication to help, and which can be a game changer when you're doing all the other things as well.
Thank you. So we have had a few questions come in while we're on this webinar. So I'm just going to ask a few of them. So this is probably one that a lot of people are going to ask the same one. So I feel like I'm clenching my buttocks. Is that what you mean by squeezing the pelvic floor?
Nope. Okay. So everybody, and thank you for bringing that up, because I forgot to say that. So because I can't see, it's quite difficult. I find it difficult when I can't see. So I want everybody, if you're sitting down, okay, nice and comfortable, sit on the bottom. Now, I want everybody to clench their buttocks as tight as you can. Okay, I'm exaggerating it and I'm going back down again. Okay, I'm really exaggerating it there. You shouldn't feel that when you're doing your pelvic floor. So that's your buttocks clenching, and let go. Now, relax those buttocks. If you want, put your hand on the outside and just under the buttock a little bit, and feel as if you're trying to stop passing wind. So where a whole group of us are here with royalty, okay? I don't want to let the Irish side down, definitely have to hold it in. You don't want to leave it out, okay? And you're zipping up all the way up past the vagina, up past where you wee, and up to the pubic bone. That's what you want. So you'd feel it under your hand and let it go, okay? You will feel around maybe the anus pulling in at the buttocks slightly, but you shouldn't feel out on the bigger side of the buttocks, okay? And that's really important to get that first, because if everybody now squeezes their buttocks as tight as they can and now try and pull up your pelvic floor, it's quite difficult. Okay, so it is. So make sure you're really zipping up first, initially working that. Okay, and then that's part of progressions later on, bringing the buttocks back into it. But just for the general pelvic floor, Billy Basic, you're not bringing the glutes in.
Thank you. So going to the other end now, can you give advice on how to let the pelvic floor relax?
Yeah, so breathing is one of the biggest things, diaphragmatic breathing. So you're breathing, like I said at the start, that you're breathing down into the belly, okay? And that's what's really important. So you're breathing into the belly. If you know you struggle with a high tone pelvic floor, a really good thing is to do it every night. I find a minimum of 10 minutes works really well, and lying down, and sometimes even opening the legs to open up that pelvis and let those knees, so pretend these are my knees, the knees resting on cushions or pillows, and breathing into that belly works really well. And don't do your pelvic floor exercises until you can learn to leave it go. And if you're struggling with that, then I definitely would recommend seeing a physio.
Thank you. So my GP recommended the LV pelvic floor trainer, which I bought. What are your thoughts on this? How many times a week should I use it for improvement, as it suggests 3 times a week? Is that enough?
Okay. I'm around a long time. I've seen these come and go and come in out and get more expensive all the time. Yeah, some of these gadgets can be really good. But you know, you don't want to be, in the long run, most of the things you don't want to be doing is sitting down or lying down and using them, because actually you want your pelvic floor to be working when you're doing other positions. So they can be really helpful to get people engaging at the start, if that's the type of person you would be. Mine would sit in a box in the corner. I wouldn't use it. So it just depends. If you like apps and you like tech, it might help you, but just make sure you're squeeze and lift, that you're not pushing it out. That's the only thing. Make sure you're squeeze and lift and you progress it as able. To be honest, it's ages now since I've even used or had anyone with an LV. I think you can do them in standing, and then, you know, making sure you're progressing on and you're using it right. So sometimes with some of these gadgets, make sure you don't have it so far up that you're not feeling that you're having to hold it in. Like a tampon, we don't go around holding a tampon in. So make sure it's lower down. So if this is the pelvic floor, my finger that's the gadget you want, then your pelvic floor lifting it up. Okay, you don't want it up here and then your pelvic floor not really doing anything. Okay, how many times a week? That depends on what you feel and what the instructions. I don't always go by the instructions when I'm telling, because, you know, we can change that as physios. But unless I know somebody, I don't know how many times to tell you. So apologies on that. But make sure and let your muscles go afterwards.
Okay, I'll just do a few more if that's okay, Debbie.
Yeah.
So I've got, I leak when standing up. I have a prolapse. Does the prolapse stop all the urine from leaving?
Okay, so you can have different issues. Some people with the prolapse, depending where the prolapse is. So if the prolapse is the anterior wall, so the cystocele, some people, as they stand up, the prolapse might be dropping a bit, so that actually, so if that's the vaginal wall and the prolapse is pushing in, it actually might stop leakage. And some people are like that. And then when they get the prolapse fixed, they might have leakage. And some people are the other way around, that they find they can get a little bit of a dribble. So one, make sure when you go to the toilet, you sit on the toilet properly. And that goes for everybody having a wee. Sit on a toilet, don't hover. The only excuse I give people hovering is Glastonbury Festival, because we all understand that one. We're all in Somerset. So basically, don't hover. You need to sit on the toilet seat. When you're sitting, you might find you have to lean forward. You might have to give a little wiggle, stand up and sit back down again. You know, just to unkink, and kind of, some people even stand up, turn around and sit back down again, just to kind of unkink what could be happening with that prolapse. The other thing is you could trial a pessary. You know, you could trial a pessary to take that loading off for you, and that might help. And that will also give you an idea to what's going on with the pelvic floor when you take that prolapse out of the way. So yes, hope that answers.
Okay, we're running out of time, so we'll see how we go with this one. Possibly get one more after this one. So my 9-year-old and my 14-year-old are both complaining about leaking. This seems very abnormal to me. Do I just get them to do pelvic floor exercises?
So I first of all would make sure that there's not any other issues why they would be leaking. So you know, sometimes it can be due to stresses and different things. It can be due to anxiety, but it equally, and school toilets are a big issue now. So, you know, it could be factored in that they're fine when they're off school and on school holidays. I would check that. And it might be worth just checking in with your doctor. The other thing is making sure their bowels are working, because if their bowels aren't working, you could have easily issues with their pelvic floor. So it's very hard for me kind of to say, oh yeah, off you go and do the pelvic floor. So I would probably check with your GP and make sure. And then after that, check with your GP. And if they're happy with everything, they might decide to send them to the pediatric continence team, who are a brilliant service. I'm not too sure of their weights, but they are an excellent service. And they send people in to us if needed. And then if they're happy and everything's fine and their bowels and everything are working and doing all of that positioning with the bowels and blowing the bubbles or the candles, I would then make, especially if they're athletic and they're doing a lot of exercise, I would make sure they're leaving their tummies relaxed. And actually, everyone on the call, can everyone let their tummies go? That is one of women's biggest faux pas, that we continuously hold our tummy, which then pulls on the pelvic floor. So if you go through the breathing stuff with them, and then you can maybe then they can start doing their pelvic floor exercises. The other thing is just not letting them continue, and this is the same for any adults as well, just trying not to give in to always needing to go to the loo, or not telling your daughters or grandchildren or yourself, oh, I'll go for a wee just before I leave. And then you come home from the school run and, oh, I'll go for a wee now just because I've come back in. Don't get into that habit, and definitely don't get your kids or grandchildren into that habit.
Thank you. Okay, we're going to do one more because we are just about out of time. Is there an alternative to the mesh if surgery is the only answer for prolapse?
That's a difficult one. The mesh. So mesh isn't used. So there is different types of surgery that they are doing instead of mesh. So mesh isn't used for prolapse surgery. So if you do, if you have been to a consultant or you're waiting for a consultant, have a good chat through the British Society of Gynecologists, isn't it, BSOG, BSOG, have some good resources and operations and different things. So yeah, and really chat through with your consultant. There is some fab ops that they're doing. They rarely use mesh now. Really, they don't use it for anything until it's they've decided what they're going to do with it. So yeah, and I would be doing all the other stuff. You can do what I've been saying about prolapse. So constipate, watching the bowels, not straining, making sure you're doing your pelvic floor, having a pessary if needed, and making sure when you're lifting or doing exercise, you're doing it correctly.
Thank you. I'm afraid there are more questions, but we will have to draw it to a close, I'm afraid. This webinar has been recorded, so it will be available for everyone to watch. We can send you out a link later on. There's also going to be a FAQ that will come out to you all as well. So all that leaves me to say is thank you to Debbie for such a wonderful webinar, but also thank you to all of you for giving up your evening and coming along. So thank you very much. I hope people found it useful. Thank you.
Thanks, Mel. Thank you, everybody.